Banerjee ji.
Thank you for giving me the opportunity to speak on this subject. Madam, during last 21 months, the fight which has been fought against COVID-19, that fight was fought by everyone of this country, and no one should claim or seek credit for that, not a single individual. Madam, almost 2 years after the World Health Organization declared COVID-19 a pandemic, the world is coming to terms with the disruptions caused by the virus. Government action to counter infections and contain the spread of the virus led to global supply shocks, especially in manufacturing, and lockdowns and other containment measures caused widespread business disruption. It is now clear that the pandemic has brought the world to the second great economic and financial crisis of the 21st century and is likely to have long-term structural repercussions. What is more, it has laid bare the fragilities of the global economic and geopolitical order. As on 1st December 2021, COVID has taken lives of 4,69,724 Indians as recorded by the government. Over 30 million people have been infected by the coronavirus in India. COVID-19 can infect people of all gender and ages. The pandemic has exposed and exacerbated existing inequalities and their impact on vulnerable groups who are mainly employed in the informal sector. Going forward, India will have to prioritize economic expansion and sustainability to maintain its trajectory of growth and influence. The country must continue to embrace transformational rather than incremental change to shape an economic policy that supports rapid growth. Wage inequality and the burden of unpaid cases has pushed more people out of employment into poverty. The Indian economy has clearly fallen behind by several years. If one looks at the gross domestic product GDP numbers, the sectoral value added in manufacturing and construction or the actual offtake of items like electricity, steel, cement, vehicles, and so on. India will also need to continue making strides to increase competitiveness and the ease of doing business. Madam, the country will also have to ramp up its infrastructure efforts, not just for roads and bridges, but for health and education too. Amid the ongoing volatility and change, India has a rare opportunity to undertake several policy changes to not only address the short-term public health challenges, but also to become an important axis of power and influence in the post-COVID world. From its devastating economic impact and its migrant crisis to this starting death toll, the COVID-19 pandemic in India unfurled one crisis after the other. Sir, Madam, as on 28 November 2021, a total of 70.19 crore beneficiaries, that is 83.3% coverage against estimated adult population aged 18 years and above, have received at least one dose of COVID-19 vaccine. Madam, I am astonished to hear that someone is saying 110, 115, ringtone is saying more than 100 vaccination has been made. Madam, in our country, 135 crores people are there. Above 18 and above, 18 and below, how much? It comes to 95 crores only. How it can be? More than 100? Up to 18 years, no vaccination has been made? How it can be? There should not be any jugglery of numbers here. Plain and simple. Have you done? Have you administration vaccination up to the 18 years? Answer is no. If no, how it can be more than 100? Simple mathematics it is. Madam, out of total around 2 crore 90 lakhs number of disabled persons in the country, only 8,390 people with disabilities received first dose of COVID-19 vaccine and 4,018 have received both doses of COVID-19 vaccine. the slow pace of vaccinations is likely to be a burden on India's economic recovery. The second wave of COVID-19 in India brought unprecedented losses. The poorest and the most marginalized, including women and girls, face more risk without the means to absorb the economic shocks and mitigate the health crisis. In India, women make up a significant proportion of all healthcare workers and more than 80% of nurses and midwives. Yet, when it comes to decision-making roles in the health sector, they are largely absent and they get paid much less than their male counterparts. However, some women and girls may be at higher risk because they are poorer and lack information and resources, or because they are at the front line as caregivers and workers in the health and service sectors. Right now, there is also a concern that less women are getting vaccinated than men in India. Minus 17% more men than women have been partially or fully vaccinated, and according to national data. Every crisis impacts women and girls differently than men because of existing gender norms and inequalities. To build back better and equal from the COVID-19 crisis, policy, investment and action must be shaped by women and girls and deliberately targeted them. Central Drugs Central Control Organization has also approved ZY-CoV, that's D, vaccine of Cadila Healthcare for restricted use in emergency situation in the age group 12 years and above. Our government has not yet cleared final recommendation therein. Across the country, lack of access to resources, high levels of digital literacy, and the deepening digital divide exacerbated by the pandemic acted as major roadblocks in India COVID-19. Even as the government announced relief packages, food grants and cash payments, the mechanisms of delivery to beneficiaries at the last mile were unclear. Madam, I will not take much time. There's so many things to say. Our other speakers are there, some few points. When India was hit by the pandemic in April 2020, about 126 million jobs were lost. That's really a lot. About 90 million of those jobs were of daily wages. Madam, may I put these questions to this House? Here, sitting here. All we cried for the migrant laborers. But why? In our country, now no mechanism has been set up for registration of migrant laborers in every state nationwide. Why it is not there? Whose fault it is? It is whose fault? Why it has not been thought? Madam, when CMI has been pointing out for a long time that there is a steadily fall in salaried jobs and that's not abating. We had 403.5 million jobs before we were hit by the COVID-19 pandemic. Best case scenario in January 2021 or December 2020, we reached 400 million jobs. So we were still 3.5 million jobs short. Today we are at 390 million. Enterprises are unwilling to do anything because they have got only 66% capacity utilization. Madam, the public health sector includes national, state and district level governance systems. Madam, give me 3 minutes. Just 3 minutes I will. Systems across the country. Speaker साहब बोला था जितना मर्जी तितना उतना बोलो, जो बोलना चाहता है उसको उतना बोलने दो. स्पीकर साहब ने बोला है. That's right. आप पूछ लीजिए. The public health sector includes national, state and district level governance systems across the country. Yes, across the country it enables a coordinated response across the system. The private sector on the other hand is highly fragmented and has no such governance system to mount a coordinated response. Madam, I am coming to a very sensitive place. Madam, what I feel in my own way, who are the worst sufferers today in our country because of the COVID-19? They are the children. They are not getting their normal life. They are not in a position to meet their friends. They are not in a position. Their mental grown-up is really jeopardized. Madam, this is through you, madam, kindly, just 2 minutes. 1 minute. Just, madam, through you, madam, I will request to the Honorable Health Minister. please very quickly bring vaccination for the children. Let them remain, let them enjoy their normal life. If you have a child, if you have a grandson, then you will understand what pain they are having, what pain they are suffering each and every day. Madam, on the other day, the Honorable Minister has very categorically stated that Omicron COVID-19 variant, no cases in India as they reported. I will request the Honorable Minister through
Shri
you,
Krishna ji.
what are the steps have been taken? Sir, Madam,
Yeah,
just
but time
finishing this sentence. Allow me to finish this sentence. What are the steps have you taken to prohibit the Omicron COVID-19 variant to enter into India? Madam, thank you. कल्याण किया ना आप